Hi there, I'm Senior Chiropractic Intern Nick Fedele here at the Life West Health Center, and right now we're going to be doing a review of findings. All right, so here we go. Good morning, Nicole. It's an absolute pleasure to see you again. I hope you took our advice last night and took it easy and followed the instructions we gave you last we saw you. I see you brought Dave with you today. I'm really glad that he came with you because it's very important that you have a partner in health so that they can understand what you're going through with some of the pain and difficulty that you've been having. So Dave, it's nice to meet you as well. The important thing to know here, Nicole, is we can help you. The good news is we found the problem, which I'll explain in a few minutes, what we found. But first, let me show you a small video about chiropractic. Well, I hope you understand, and after that, and I'd kind of go over the video with her and say, well, I hope you understand the video that you just watched because I think it's an important part of your education in chiropractic. Nicole, remember the part in the video, I kind of go over and tell her what it was all about and kind of relate it back to the subluxation. I have it here in my script. All right, Nicole, it's obvious right here that you have subluxations going on. Much like in the video, the subluxation breaks down into many components, muscles, nerves, and bone, all of which have everything to do with posture and structure. So if you have postural deviation or structural deviation, what that means is that due to the fact that you're doing something every day the same way, you're causing retraining in these muscles. And it might be a reason other than injury why your left shoulder is low here on the x-ray, as you see. And because the shoulder is low, it's obvious that we're going to have to do some extra work to bring this shoulder back up. This means rehabilitation, restructuring, which will help restructure your spine. We're going to go through this because we also know, too, that you have some headaches and some low back and some neck pain. Nicole, this is how your spine should move, okay? Obviously, you have some fixation down in your hips, your L5, T6, T10 area. We got here recorded C1 and C2 regions as well. Let's go over here to our charts and see the effects. All right, and Dave, I think it'd be a good idea while you're here with Nicole and you're learning all this that you come in as well. If you're going to be bringing Nicole, you might as well get some significant relief as well. I'd like you to set up an appointment at our front desk, and I'll let you think about it while you listen further. All right, Nicole, there are 3 different types of care that we give here. Naturally, the object is to have you first get out of pain and relieve your system. Pain reduction is very important, but most important is restructuring and rehabilitation, which is the second phase of care. Restructuring and rehabilitation is good for helping to increase mobility of the joints and for strengthening and stretching the muscles. If you had this problem for a long period of time, in the long run, you want to get rid of this problem. You don't want it to be something that is going to be constant in your life. The third phase is wellness care. In wellness care, you come in for maintenance basis periodically in case you do have some problems. But we don't look at things from the standpoint of waiting until you're in pain to finally get out of pain. Rather, we look at everything from a prevention standpoint, which is why you're coming in, which is good. You're in the right place. Okay, so our plan for you, with the serious condition that you have going on here and the restructuring and rehabilitation that we need to do, meaning exercises, strengthening, and the wellness program we mentioned to you, you're looking at about 5 dozen treatments over the next year. And let me explain this to you. Think of braces of straightening out teeth. They're easily to put into place. Straightening your spine, however, is going to be even more difficult job because unlike teeth, they're not stationary. These vertebrae actually move, obviously. Helps keep you upright and you use it during your motion. This type of work that you do, your lifestyle, has not allowed you to do some of these things that you need to do to help yourself. We're going to have an exercise program that is going to be specifically designed for your specific problems. Let me say further that the first thing I want to do is to see you 2 times more this week and at least 3 times next week so it can get you out of pain. Once you're out of pain and you're not having as much soreness, we're going to drop your care down to 3 days per week for the first 8 weeks. Is that okay? Every 30 days, We reevaluate you with a progress evaluation and possibly drop your care down further a little sooner or remain with the same schedule depending on if your symptoms are getting any better or not. It's important you understand the severity of your case and how long this can take. When you're coming in 1 day a week for 12 weeks, you'll be on a wellness program. And provided everything is wonderful, and then we'll reduce your visits down to once every other week for 6 months. That doesn't sound too bad, right? At first, it's very intensive care. As over time, it becomes wellness and prevention. It's just something that you want to do because you'll be feeling that much better and that much different about your health. It'll be something you want to do. Do you have any questions?